If you've ever sat down to breastfeed your baby and felt that sharp sting or aching throb in your nipples, you're not alone. Many new moms find themselves wincing through the first few weeks, wondering if this is just what breastfeeding feels like or if something is wrong. You might even feel torn between the joy of nourishing your little one and the dread of that next feeding session. It's such a conflicting place to be, wanting to give your baby the best start in life, while your body quietly pleads for relief. Let's be clear, right from the start, you are not weak for feeling that pain. Breastfeeding can be deeply emotional, but it shouldn't be physically miserable. The tenderness, cracking, and soreness that some mothers experience aren't something you just have to push through. They're your body's way of saying, I need a little help here. And the good news is there are gentle, effective ways to soothe that pain and care for your breasts while continuing your breastfeeding journey with confidence. Imagine this. It's 2 a.m., the room is quiet except for your baby's tiny sounds. You settle into your chair, ready to feed, and then ouch, that first latch brings a burning sting. You tense up, hold your breath, and glance down at your baby's face, thinking, am I doing something wrong? You adjust positions, try again, and feel that same sharp pull. Tears start welling up, not just from the pain, but from the frustration that something meant to be natural feels anything but. This moment is where many mothers reach a breaking point, but it's also where understanding what's really happening and how to fix it can make everything change. Because most nipple pain has a cause, and when you address that cause, instead of just enduring it, breastfeeding can shift from painful to peaceful. One of the most common reasons for nipple pain is an improper latch. Even a tiny misalignment between your baby's mouth and your breasts can cause friction, compress the nipple, and leave it sore. If your nipple comes out flattened, pinched, or shaped like a new lipstick after a feeding, that's a clear sign something isn't quite right. The key isn't in forcing your baby to nurse differently, but in helping both of you find a rhythm that feels natural and comfortable. Try to picture your baby's mouth like a soft cushion, not a tight clamp. Their lips should be flanged outward, their chin pressing gently into your breast, and you should feel a strong but comfortable pull, not a pinch. Sometimes, even the smallest adjustment, like bringing your baby's nose in line with your nipple before latching or supporting your breast with your hand, can make all the difference. Now, while latch issues are often the main culprit, they're not the only one. Sometimes, the soreness comes from overly frequent feedings without enough healing time in between, or from dry, cracked skin that needs moisture. And other times, it's a sign of thrush or bacterial irritation, especially if the pain feels like it's deep inside the breast or accompanied by itching or burning. Whatever the cause, the message is the same. Your body needs care, not endurance. Let's talk about that care. When your nipples are sore, every little action can feel magnified. The brush of fabric, the stickiness of dried milk, even the shower spray, it all adds up. So start by giving your breasts the same gentle care you'd give a newborn baby's skin. After each feeding, express a few drops of your own breast milk and gently rub it onto your nipples. It may sound too simple, but breast milk has natural healing and antibacterial properties. It's like your body's own medicine. Then, let your nipples air dry for a few minutes before covering them. Avoid rubbing them dry with towels. Instead, pat gently with a soft cloth. If your nipples are cracked or bleeding, using a thin layer of purified lanolin or medical-grade nipple cream can lock in moisture and protect against friction. You can even use hydrogel pads for cooling relief. They're soothing little miracles when your skin feels raw. But perhaps the most healing thing you can do, just physically giving yourself permission to slow down. Breastfeeding is not just about feeding a baby, it's a relationship. It takes time for both of you to learn each other's cues and comfort zones. Some mothers find relief by varying positions, switching from cradle hold to football hold or side-lying position to relieve pressure on sore spots. Others find that short, frequent feeds help more than long, painful ones. And here's something every mom needs to hear. If you need to take a brief break and pump or hand express instead of nursing directly, that doesn't make you any less of a breastfeeding mother. Sometimes, stepping back for a day or two to let your nipples heal can make your journey smoother in the long run. You're still providing your baby with your milk, your care, and your love. That's what truly matters. Now, let's pause for a moment to recognize something important: the emotional side of nipple pain. Because it's not just about physical discomfort. It's about those moments when you feel guilty for dreading feedings, or when you cry quietly in the dark because you want this to work so badly. You might even find yourself scrolling through forums at midnight, searching for reassurance that it gets better. And it does. Truly, it does. Every mother's breastfeeding story has its own rhythm. Some days feel effortless, and others are filled with trial and error. But with each feed, each gentle adjustment, and each small act of care for yourself, you're building something far more meaningful than just a feeding routine. You're building trust between your body and your baby. As we move forward, we'll explore the deeper layers of nipple and breast care, how to spot early signs of infection, how to prevent blockages or mastitis, and how to restore your confidence with each feeding. Because while the soreness may start with your skin, the real healing begins with understanding, patience, and compassion for your baby and for yourself. You're not just nourishing your child, you're learning to nurture yourself too. When nipple pain lingers longer than a few days or feels intense, it's a gentle signal from your body to pause and pay closer attention. Many mothers think that discomfort is just part of the journey, but in truth, consistent pain is not normal. It's a sign that something deeper needs care. And acknowledging that doesn't mean you're failing. It means you're listening to your body's wisdom. Let's start by looking at what might be happening beneath the surface. Sometimes, small cracks or sores become vulnerable to infection, especially if moisture gets trapped between feedings. A warm, slightly swollen area, or a nipple that looks shiny and feels itchy or burning, might suggest a yeast infection commonly known as thrush. It can happen after antibiotic use, or even just from the natural balance of your skin shifting postpartum. If you notice that your nipples hurt even when your baby isn't feeding, or if your baby develops white patches in their mouth, it's a good idea to check with your healthcare provider. Then there's the issue of blocked milk ducts, those tiny, painful knots that make one spot of your breast feel firm or sore. They can appear suddenly, often after long stretches between feedings, tight breaths, or awkward sleeping positions. And while they may seem small, ignoring them can lead to mastitis, an infection that brings fever, chills, and deep ache. The moment you feel a lump or localized tenderness, treat it like a priority. Apply warm compresses, massage gently toward the nipple, and nurse frequently from that side to keep milk flowing. The truth is, breast care during breastfeeding, isn't just about comforted about protecting your health and preserving your bond with your baby. Every ounce of attention you give your own body allows you to show up more fully in those quiet moments of connection. When your baby gazes up at you, tiny fingers curled against your skin. Now, here is something many new mothers don't realize. Your daily routine plays a quiet but powerful role in your breast health. Something as simple as your choice of bra can make a difference. Tight, restrictive bras or synthetic fabrics trap moisture and increase friction. Soft, breathable cotton or bamboo fabrics are your best friends right now. They allow air circulation and reduce irritation. If you use nursing pads, change them frequently, especially after each feed, so your nipples stay dry and clean. And while it might sound indulgent, even the temperature of your shower can matter. Hot water can strip away natural oils from your skin, leaving your nipples drier and more sensitive. Lukewarm water and mild fragrance-free soap are usually best. Afterward, pat gently and let your skin breathe for a few minutes before dressing. These tiny habits may seem insignificant on their own, but together, they create the environment your body needs to heal and thrive. There's also an emotional layer here that's easy to overlook. Breast pain can make you feel isolated, even when surrounded by support. Some mothers quietly carry guilt, feeling as if they should be stronger or shouldn't complain. But you deserve care and comfort just as much as your baby does. In fact, your well-being directly affects theirs. Babies sense your tension, your relief, and your calm. When you take the time to soothe yourself, you're also creating a calmer feeding experience for them. Let's imagine a little shift in your day. You're preparing for a feeding session. Instead of rushing, you take a slow breath. You sit somewhere comfortable, maybe with a soft pillow supporting your arm or a warm compress on your chest. You check your baby's position, bring them close, and wait for that wide open mouth before guiding them gently toward your breast. When the latch feels deep and comfortable, your shoulders drop, your breathing slows, and that familiar twinge of pain fades into something gentler, just the soft rhythm of connection. This small moment of ease is what we're working toward. And while healing takes time, it often comes faster than you expect when you approach it with intention. Your body is designed to recover. The skin on your nipples regenerates quickly, and with each feeding that feels a little better, you're building trust in the process. Remember, progress isn't always linear. Some days you'll feel almost back to normal, and others you might notice a flare of soreness. That's okay. Healing often moves in waves. What matters is that you keep listening to your body and adjusting as you go. If your pain persists or worsens, don't hesitate to reach out for help. Lactation consultants are incredible allies. They can watch a single feeding and notice subtle details you might miss, like your baby's lip position, your breast angle, or how your milk flow changes during letdown. Sometimes just one session can completely transform your experience. And please, never underestimate the power of support. Talking with other mothers who've been there through the sore days, the cracked skin, and the doubts can be profoundly comforting. Hearing them say, "It got better for me, and it will for you too," can be the reassurance that keeps you going when you're ready to give up. Over time, what once felt painful becomes second nature. You begin to recognize your baby's hungry cues before they cry. You adjust without thinking. The sharp pain fades, replaced by warmth and calm. You realize your body and your baby have learned each other, and that's something truly beautiful. So, as you move forward in your breastfeeding journey, remember this: every tender act of self-care you give to your body is also an act of love for your baby. You're teaching them, without a single word, that nurturing begins with gentleness, and that includes how you treat yourself. You are doing an amazing job. Breastfeeding isn't easy, but it's a deeply human experience, messy, beautiful, and powerful. Your body is learning, healing, and giving in ways that words can hardly capture. If this video helped you, remember to like, share, and subscribe so more mothers like you can find the support they deserve. And in the next video, we'll talk about something every new mom wonders at some point: what to do when breastfeeding hurts. We'll uncover why it happens, how to tell when it's normal, and when to ask for help. You're not alone in this, and I'll be right here to guide you through it. See you there.